Good day everyone, my name is Noel Yap Choi Kwan and I will be starting off our presentation on Lids and Lacrimal Apparatus. I'm pleased to introduce my group member who have worked together with me on this project, Mr. Sunny Dan, Mr. Wong and Mr. Jordan Chin. Each of us contribute equally to this presentation and we hope you find it informative, clear and engaging. So let's get started. Introduction. The eyelid play an important role in eye protection. With every blink, they help spectacle every, protect the cornea from injury, and reduce evaporation by closing the eyes. The lacrimal apparatus include the gland that produce tears and the drainage system that remove them. Together, they work in harmony to produce, distribute, and drain tears, keeping the eye surface smooth, moist, and free of irritant. When this system is disrupted, it can lead to discomfort, blurred vision, or even more serious eye disease. Next, let's talk about the eyelids, also known as pupillary. The eyelids are thin, movable, full of skin and muscle. They also a key role in protecting the eye from injury, bright light, and foreign particles. Every time we blink, the eyelids help spec the tear film evenly across the cornea, keeping it moist and clear. They also assist in draining tear through the tear drainage system, starting for the plantar, into the canaliculi, then to the lacrimal sacs, and finally into the nasolacrimal duct. Additionally, the eyelids contain special structures like eyelash and gland that help support both protection and lubrication. Now, I will pass this over to Sunny, who will explain more about the tear film. Thank you.
Good day everyone, my name is Sunny Dan VG and today I will be introducing you to something very important but often overlooked called the tear film. So what exactly is the tear film? Well, you can think of it as a thin watery blanket that covers the front surface of your eye, mainly the cornea and a little of the conjunctiva. It's like your eyes are really your own screen protectors. It has three very important jobs. First, it keeps your vision sharp by smoothing the surface of your eye, like cleaning a window. Second, it works like natural eye lotion, keeping your eyes moist and protecting them from dust and bacteria. And third, it acts like a nutritious eye smoothie, delivering oxygen and nutrient to the cornea to keep it healthy and strong. So, even though we barely notice it, tear film is working hard every moment to protect our sight. Now, let's talk about the tear film layers and their function. It's not just water in your eye. It's actually made up of three special layers and each one is produced by a different part of the eye. First, we have the lipid layer or the oily layer. This one is the outermost layer and it's made by the Meibomian glands in our eyelid. Its job is pretty simple but super important. It shows down evaporations like a lid on a pot of soup. Without it, our tears would dry up so fast and very fast. So next is the aqueous layer, the watery part right in the middle. This comes mainly from the lacrimal gland and also from a few smaller helper glands. It hydrates the eye, bring in the nutrients and even has antibacterial proteins like isozimi to keep our eyes clean and healthy. Finally, we have the mucin layer, the innermost part closest to the eye surface. This is made by goblet cell in the conjunctiva. It helps the watery layer stick to the eye so it spread evenly instead of just rolling off. So why do we need all three? Because they work as a team. If even one layer is weak, like if the lipid layer is so thin, the tear film break apart too fast, that when we get dry spot and the eyes start to feel irritated or gritty. So healthy tears need a healthy team of layers working together. On this slide, you see two label cross-section that illustrate the tear film and its associated glands. At the very top, you'll notice the lipid layer, which acts like a protective seal to prevent evaporation. Right beneath it is the aqueous layer. This is the watery part that keeps the eye hydrated and protecting from the debris. The innermost layer, lying directly against the corneal epithelium, is the mucin layer. It helps the watery layer spread evenly and stick to the eye surface. Also shown are the Meibomian glands located along the eyelid margin. These glands are essential for production of the lipid layer. If they have become blocked or dysfunctional, what we call Meibomian gland dysfunction or MGD, it can lead to evaporative dry eye. Understand this structure helps explain not only how the eye stays moist, but also why certain disorders like dry eye disease are so common. And with that, we'll move on to the next sections, the lacrimal drainage pathway. Now, I pass it over to Mr. Jordan to take you through it. Mr. Jordan, please.
Hi everyone, my name is Jordan Chinyuno, and today I will be discussing an essential component of our ocular system, the lacrimal drainage pathway. Once tears have done their job, keeping the eye moist, clean and protected, they don't just stay there. They need to be drained away to prevent blurry vision or eye discomfort. That's where the lacrimal drainage system steps in, starting from the puncture and ending in the nasal cavity. This pathway allows used tears to exit the eye efficiently. You can see this whole route clearly in the diagram. Its structure plays a role keeping the tear balance just right. Now we look at this slide. Components of the lacrimal drainage pathway. The lacrimal drainage pathway consists of several components. The first is puncture. These are tiny openings located at the inner corner of both the upper and lower eyelids, near the nose. There are two punctures, one on the upper lid and one on the lower lid. This opening begins the process of tear drainage. And the second is canaliculi. Once the tear enter the puncture, they travel through the canaliculi, small horizontal channels. These channels direct the tears toward the next part of the pathway. And the next is lacrimal sacs. The tear then collect in the lacrimal sac, which act as a temporary reservoir. The lacrimal sac is located in the inner corner of the eye, just before the nasal lacrimal duct. And the next is nasal lacrimal duct. This tear flows from the lacrimal sac into the nasolacrimal duct, a vertical tube that carries them downward toward the nose. And the last is inferior nasal meatus. Finally, the tear empties into the inferior nasal meatus inside the nose. This is the reason why you may experience a runny nose when you cry, as tear drain into the nasal cavity. So, what actually happens when the tear production or drainage system doesn't work as it should? This slide presents a labeled comparison between a normal tear drainage system and a blocked tear duct, allowing us to visually understand how anatomical change can impact tear flow and ocular health. On the left, we observe the normal tear drainage anatomy. Tears are produced by the lacrimal gland and spread across the ocular surface. Excess tears then enter the superior and inferior puncture, located at the nasal side of the eyelids. From there, they travel through the canaliculi into the retinal sac, and finally train via the nasolacrimal duct into the inferior nasal meatus. This drainage pathway is unobstructed, which ensures that the ocular surface stays moist without the tear overflow. In contrast, the right image shows a blocked tear duct, specifically at the level of the nasolacrimal duct. This obstruction prevents tear from entering the nasal cavity. As a result, tear accumulate in the lacrimal sac, leading to epiphora or excessive tearing. In some cases, the stagnation of tears can promote bacterial growth, resulting in dacryocristitis, a painful infection characterized by swelling, redness, and discharges near the inner canthus. Building on what we will discuss earlier, let's take a closer look at the real-world consequence of tear imbalance. When the eye doesn't produce enough tears, or when those tears can't drain properly, discomfort and even eye disease can occur. On this slide, we highlight two common conditions that illustrate this problem: dry eye syndrome and dacryocystitis. Each of these show how even a small issue in tear flow can affect eye health in a big way. Decreased tear production, this can lead to dry eye syndrome, where the eyes feel dry, sting, and become blurry. Without enough tear, the cornea is more easy injury and the eye can become irritated. Blocked drainage. When the lacrimal drainage system is blocked, it can lead to epiphora, excessive tearing that overflow onto the cheeks. This may occur due to congenital blockages, age-related narrowing, or chronic inflammation. If left untreated, stagnant tear in the lacrimal sac can become infected, leading to a condition called dacryocystitis, which causes swelling and pain near the inner corner of the eye. That concludes my part on the lacrimal drainage pathway. Now, I would like to pass it over to my teammate, Mr. Wong, who will be presenting the reflection and summary section. Thank you.
Thank you, Jordan. Hi everyone, my name is Wong Leong Yang, and I will be presenting the next section on reflection, reduced tear production. This condition occurs when our eyes do not produce enough tear to maintain a healthy surface. There are a few key causes. First, age-related reduction in lacrimal gland function. As we age, our lacrimal gland become less active and tear production naturally decrease. Second is the long-term contact lens wear of certain medication. Wearing a contact lens for many years or taking medication like antihistamine or antidepressant can reduce tear output. Third, autoimmune disease such as Sjogren's syndrome. In these cases, the immune system attacks the body own tear glands, leading to dryness and discomfort. When tear production is reduced, the surface of the eye becomes dry. This can result in irritation, a burning sensation, and blur or fluctuating vision. In more serious cases, the cornea may become damaged, sometimes forming ulcer if not treated early. Moving to the next slide, let's talk about the effect of reduced tear production. The most common result is dry eye disease, causing dryness, irritation, burning, and a foreign body sensation, like there's sand in the eyes. Blurry or fluctuating vision. The tear film plays a key role in keeping a cornea smooth. When it breaks up too quickly or becomes unstable, vision becomes unclear or changes throughout the day. When the eyes remain dry for a long time, patients may begin to rub their eyes often. There is a natural reaction to relieve discomfort, but it can make the problem worse. They also feel uncomfortable in rainy places or air conditioner rooms because this environment dries out their eyes even more. In more serious cases, the cornea can be damaged. Without enough lubrication, the surface of the cornea may develop erosion or even ulcer, which can affect vision and increase the risk of infection. That's why it's important to manage dry eye early before it leads to more serious complications. Next, let's look at the refraction on blocked tear drainage and its causes. Congenital blockage is occur when the nasolacrimal duct is blocked from birth. See the picture on the left. The baby has watery eyes due to this congenital blockage is actually quite common in infants. Age-related narrowing. As we grow older, the tear drainage system may become narrower, reduce drainage efficiency and leading to watery eye, especially in the elderly. Chronic infection or inflammation, long-term infection can damage or scar the tear duct, blocking tear flow. On the right, you can see swelling near the nose from dacryochrysitis, which is inflammation of the lacrimal sac. In all of these cases, tears are produced normally but cannot drain properly, leading to overflow and discomfort. Okay, now let's move on to the effect of blockage drainage. The most common symptom is epiphora, which means tear overflow onto the cheek because they cannot drain properly. As seen in the picture on the left, the patient shows excessive tearing, a large sign of drainage blockage. When tears stay stagnant, they may become infected, resulting in dacryocystitis, a condition with pain, swelling near the inner eye corner, and discharge. As you see on the right, the eye area is swollen and inflamed. Patients may also experience social discomfort, feeling embarrassed due to constant watery eyes. Even though tear production is normal, this drainage problem makes it look like excessive tearing. To wrap up my part, here's a quick summary. The eyelids, tear film, and lacrimal drainage system work together to maintain a healthy eye surface and clear vision. Keeping this system balanced is critical. Too few tears result in dryness, discomfort, and blurry vision. Blocked drainage causes watery eye and raises the risk of infection. By understanding how each system works, we can better explain patient symptoms and recommend the right treatment, whether it's artificial tear, warm compress, or minor surgery to unblock the ducts. Last, we will include 10 MCQ questions to test your understanding. Thank you very much.